Fundamental of Nursing Chapter 16 Nursing Assessment. A nurse is using the problem-oriented approach to data collection. Which action will the nurse take first? A. Complete the questions in chronological order. B. Focus on the patient's presenting situation. C. Make accurate interpretations of the data. D. Conduct an observational overview. Answer B. Focus on the patient's presenting situation. A problem-oriented approach focuses on the patient's current problem or presenting situation rather than on an observational overview. The database is not always completed using a chronological approach if focusing on the current problem. Making interpretations of the data is not data collection. Data interpretation occurs while appropriate nursing diagnoses are assigned. The question is asking about data collection. A nurse administers an antihypertensive medication to a patient at the scheduled time of 0900. The nursing assistive personnel, NAP, then reports to the nurse that the patient's blood pressure was low and it was taken at 0830. The NAP states that was busy and had not had a chance to tell the nurse yet. The patient begins to complain of feeling dizzy and lightheaded. The blood pressure is rechecked, and it has dropped even lower. In which phase of the nursing process did the nurse first make an error? A. Assessment. B. Diagnosis. C. Implementation. D. Evaluation. Answer. The assessment. The diagnostic process should flow from the assessment. In this case, the nurse should have assessed the patient's blood pressure before giving the medication. The nurse could have prevented the patient's untoward reaction if the low blood pressure was assessed first. Diagnosis follows assessment. Administering the medication occurs in implementation. But this is not the first error. There are no errors in evaluation. The nurse is using critical thinking skills during the first phase of the nursing process. Which action indicates the nurse is in the first phase? A. Completes a comprehensive database. B. Identifies pertinent nursing diagnoses. C. Intervenes based on priorities of patient care. D. Determines whether outcomes have been achieved. Answer. A completes a comprehensive database. The assessment phase of the nursing process involves data collection to complete a thorough patient database and is the first phase. Identifying nursing diagnoses occurs during the diagnosis phase or second phase. The nurse carries out interventions during the implementation phase, fourth phase. And determining whether outcomes have been achieved takes place during the evaluation phase, fifth phase, of the nursing process. She is the first one to coin the term nursing process. She introduced 3 steps of nursing process, which are observation, ministration, and validation. A. Nightingale. B. Johnson. C. Rogers. D. Hall. Answer. D. Hall. A patient is short of breath. What you would do first as a nurse. A. Ask patient's health history. B. Provide the oxygen. C. Check patient's SpO2. D. Physical exams. Answer. C. Check patient's SpO2 assessment. Check patient SpO2 and breath sounds. After reviewing the database, the nurse discovers that the patient's vital signs have not been recorded by the nursing assistive personnel, NAP. Which clinical decision should the nurse make? A. Administer scheduled medications assuming that the NAP would have reported abnormal vital signs. B. Have the patient transported to the radiology department for a scheduled X-ray and review vital signs upon return. C. Ask the NAP to record the patient's vital signs before administering medications. D. Omit the vital signs because the patient is presently in no distress. Answer. C. Ask the NAP to record the patient's vital signs before administering medications. The nurse should ask the nursing assistive personnel to record the vital signs for review before administering medicines or transporting the patient to another department. The nurse should not make assumptions when providing high-quality patient care, and omitting the vital signs is not an appropriate action. The nurse is gathering data on a patient. Which data will the nurse report as objective data? A. States doesn't feel good. B. Reports a headache. C. Respiration 16 deep nauseated. Answer. C. Respiration 16. Objective data are observations or measurements of a patient's health status like respirations. Inspecting the condition of a surgical incision or wound. Describing an observed behavior, and measuring blood pressure are examples of objective data. States doesn't feel good, reports a headache, and nausea are all subjective data. Subjective data include the patient's feelings, perceptions, and reported symptoms. Only patients provide subjective data relevant to their health condition. A patient expresses fear of going home and being alone. Vital signs are stable and the incision is nearly completely healed. What can the nurse infer from the subjective data? A. The patient can now perform the dressing changes without help. B. The patient can begin retaking all of the previous medications. C. The patient is apprehensive about discharge. D. The patient's surgery was not successful. Answer. C. The patient is apprehensive about discharge. Subjective data include expressions of fear of going home and being alone. These data indicate use inference that the patient is apprehensive about discharge. Expressing fear is not an appropriate sign that a patient is able to perform dressing changes independently. An order from a health care provider is required before a patient is taught to resume previous medications. The nurse cannot infer that surgery was not successful if the incision is nearly completely healed. Which method of data collection will the nurse use to establish a patient's database? A. Reviewing the current literature to determine evidence-based nursing actions. B. Checking orders for diagnostic and laboratory tests. C. Performing a physical examination. D. Ordering medications. Answer. C. Performing a physical examination. You will learn to conduct different types of assessments. The patient-centered interview during a nursing health history, a physical examination, and the periodic assessments you make during rounding or administering care. A nursing database includes a physical examination. The nurse reviews the current literature in the implementation phase of the nursing process to determine evidence-based actions, and the healthcare provider is responsible for ordering medications. The nurse uses results from the diagnostic and laboratory tests to establish a patient database, not checking orders for tests. A nurse is gathering information about a patient's habits and lifestyle patterns. Which method of data collection will the nurse use that will best obtain this information? A. Carefully review lab results. B. Conduct the physical assessment. C. Perform a thorough nursing health history. D. Prolong the termination phase of the interview. Answer. C. Perform a thorough nursing health history. The nursing health history also includes a description of a patient's habits and lifestyle patterns. Lab results and physical assessment will not reveal as much about the patient's habits and lifestyle patterns as the nursing health history. Collecting data is part of the working phase of the interview. While interviewing an older female patient of Asian descent, the nurse notices that the patient looks at the ground when answering questions. What should the nurse do? A. Consider cultural differences during this assessment. B. Ask the patient to make eye contact to determine her affect. C. Continue with the interview and document that the patient is depressed. D. Notify the healthcare provider to recommend a psychological evaluation. Answer C. Continue with the answer or consider cultural differences during this assessment. A nurse has already set the agenda during a patient-centered interview. What will the nurse do next? A. Begin with introductions. B. Ask about the chief concerns or problems. C. Explain that the interview will be over in a few minutes. D. Tell the patient I will be back to administer medications in 1 hour. Answer B. Ask about the chief concerns or problems. The nurse is attempting to prompt the patient to elaborate on the reports of daytime fatigue. Which question should the nurse ask? A. Is there anything that you are stressed about right now that I should know? B. What reasons do you think are contributing to your fatigue? C. What are your normal work hours? D. Are you sleeping 8 hours a night? Answer B. What reasons do you think are contributing to your fatigue? A nurse is conducting a nursing health history. Which component will the nurse address? A. Nurse's concerns. B. Patient expectations. C. Current treatment orders. D. Nurse's goals for the patient. Answer B. Patient expectations. While the patient's lower extremity, which is in a cast, is assessed, the patient tells the nurse about an inability to rest at night. The nurse disregards this information, thinking that no correlation has been noted between having a leg cast and developing restless sleep. Which action would have been best for the nurse to take? A. Tell the patient to just focus on the leg and cast right now. B. Document the sleep patterns and information in the patient's chart. C. Explain that a more thorough assessment will be needed next shift. D. Ask the patient about usual sleep patterns and the onset of having difficulty resting. Answer D. Ask the patient about usual sleep patterns and the onset of having difficulty resting. The nurse begins a shift assessment by examining a surgical dressing that is saturated with serosanguineous drainage on a patient who had open abdominal surgery yesterday or 1 day ago. Which type of assessment approach is the nurse using? A. Gordon's functional health patterns. B. Activity exercise pattern assessment. C. General to specific assessment. D. Problem-oriented assessment. Answer D. Problem-oriented assessment. Which statement by a nurse indicates a good understanding about the differences between data validation and data interpretation? A. Data interpretation occurs before data validation. B. Validation involves looking for patterns in professional standards. C. Validation involves comparing data with other sources for accuracy. D. Data interpretation involves discovering patterns in professional standards. Answer C. Validation involves comparing data with other sources for accuracy. Validation, by definition, involves comparing data with other sources for accuracy. Data interpretation involves identifying abnormal findings, clarifying information, and identifying patient problems. The nurse should validate data before interpreting the data and making inferences. The nurse is interpreting and validating patient data, not professional standards. Which scenario best illustrates the nurse using data validation when making a nursing clinical decision for a patient? A. The nurse determines to remove the wound dressing when the patient reveals the time of the last dressing change and notices old and new drainage. B. The nurse administers pain medicine due at 1700 at 1600 because the patient reports increased pain and the family wants something done. C. The nurse immediately asks the healthcare provider for an order of potassium when a patient reports leg cramps. D. The nurse elevates a leg cast when a patient reports decreased mobility. Answer A. The nurse determines to remove the wound dressing when the patient reveals the time of the last dressing change and notices old and new drainage. The only scenario that validates a patient's report with a nurse's observation is changing the wound dressing. The nurse validates what the patient says by observing the dressing. The rest of the examples have the nurse acting only from a patient and/or family reports, not the nurse's assessment. While completing an admission database, the nurse is interviewing a patient who states, "I am allergic to latex." Which action will the nurse take first? A. Immediately place the patient in isolation. B. Ask the patient to describe the type of reaction. C. Proceed to the termination phase of the interview. D. Document the latex allergy on the medication administration record. Answer B. Ask the patient to describe the type of reaction. The nurse should further assess and ask the patient to describe the type of reaction. The patient will not need to be placed in isolation. Before terminating the interview or documenting the allergy, healthcare personnel need to be aware of what type of response the patient suffered. A charge nurse is evaluating a new nurse's plan of care. Which finding will cause the charge nurse to follow up? A. Assigning a documented nursing diagnosis of risk for infection for a patient on intravenous IV antibiotics. B. Completing an interview and physical examination before adding a nursing diagnosis. C. Developing nursing diagnoses before completing the database. D. Including cultural and religious preferences in the database. Answer C. Developing nursing diagnoses before completing the database. Developing nursing diagnoses before completion of the database needs to be corrected by the charge nurse. Always identify a nursing diagnosis from the data, not the reverse. The data should be clustered and reviewed to see if any patterns are present before a nursing diagnosis is assigned. Risk for infection is an appropriate diagnosis for a patient with an intravenous IV site in place. The IV site involves a break in skin integrity and is a potential source of infection. The diagnostic process should proceed in steps, completing the interview and physical examination before adding a nursing diagnosis is appropriate. The patient's cultural background and developmental stage are important to include in a patient database. A patient verbalizes a low pain level of 2 out of 10 but exhibits extreme facial grimacing while moving around in bed. What is the nurse's initial action in response to these observations? A. Proceed to the next patient's room to make rounds. B. Determine the patient does not want any pain medicine. C. Ask the patient about the facial grimacing with movement. D. Administer the pain medication ordered for moderate to severe pain. Answer C. Ask the patient about the facial grimacing with movement. First, the nurse needs to verify what was observed with what the patient states. Proceeding to the next room is ignoring this visual cue. The nurse cannot assume the patient does not want pain medicine just because he reports a 2 out of 10 on the pain scale. The nurse should not administer medication for moderate to severe pain if it is not necessary. The nurse is interviewing a patient with a hearing deficit. Which area should the nurse use to conduct this interview? A. The patient's room with the door closed. B. The waiting area with the television turned off. C. The patient's room before administration of pain medication. D. The waiting room while the occupational therapist is working on leg exercises. Answer A. The patient's room with the door closed. Distractions should be eliminated as much as possible when interviewing a patient with a hearing deficit. The best place to conduct this interview is in the patient's room with the door closed. The waiting area does not provide privacy. Pain can sometimes inhibit someone's ability to concentrate, so before pain medication is administered is not advisable. It is best for the patient to be as comfortable as possible when conducting an interview. Assessing a patient while another member of the healthcare team is working would be distracting and is not the best time for an interview to take place. A new nurse is completing an assessment on an 80-year-old patient who is alert and oriented. The patient's daughter is present in the room. Which action by the nurse will require follow-up by the charge nurse? A. The nurse makes eye contact with the patient. B. The nurse speaks only to the patient's daughter. C. The nurse leans forward while talking with the patient. D. The nurse nods periodically while the patient is speaking. Answer B. The nurse speaks only to the patient's daughter. Gathering data from family members is acceptable, but when a patient is able to interact, nurses need to include information from the older adult to complete the assessment. Therefore, the charge nurse must correct this misconception. When assessing an older adult, nurses need to listen carefully and allow the patient to speak. Positive nonverbal communication, such as making eye contact, nodding, and leaning forward, shows interest in the patient. Thus, the charge nurse does not need to intervene or follow up. A nurse is completing an assessment. Which findings will the nurse report as subjective data? Select all that apply. A. Patient's temperature. B. Patient's wound appearance. C. Patient describing excitement about discharge. D. Patient pacing the floor while awaiting test results. E. Patient's expression of fear regarding upcoming surgery. Answer C. Patient describing excitement about discharge. E. Patient's expression of fear regarding upcoming surgery.